State's highly targeted approach to get vaccines into the shots of people's arms is picking up speed. The rate of doses being given out is up 110% in the past week compared to January.
And this morning, the state's vaccine subcommittee met to look back on the previous strategy and also outline data to back up that their often criticized approach was effective. 12 News reporter Anita Buffoni joins us live now in studio with the details. Anita?
Hi, Kim and Mike. Well, Rhode Island's slow vaccine rollout put the state behind others in terms of shots administered per capita, but state and health officials are pointing to data that shows the state is reducing hospitalizations on a faster rate than the national average and neighboring states.
The initial targeted approach received widespread criticism. During a meeting with the state's vaccine subcommittee, they showed data to argue their strategy was effective. This comes after Harvard University gave Rhode Island a failing grade for its initial vaccine rollout.
Timing that was taken for phase one certainly was not anticipated to get the type of grading that was referenced, but was definitely a part of what was needed in order to get the strong outcomes that we have achieved.
Pointing to data, the health department explained cases decreased among those targeted groups, including healthcare workers and adults 75 and older. On a conference call with reporters, Governor Gina Raimondo highlighted the drop in hospitalizations that led to the decision to close the 2 field hospitals in the coming days and weeks.
The rate at which we've cut our hospitalizations is among the very best in America.
Top health officials say Rhode Island's current COVID status puts the state in a good place with the more contagious variant now present in the region.
This type of drop definitely positions us for better being able to handle the worst of the outcomes that are potential from the variant becoming predominant.
Now, the health department says their initial approach was slow also because of the limited vaccine supply. A spokesperson for the health department tells me the vaccine they did have, they were being very deliberate in order to drive down hospitalizations. Now the state is receiving thousands more doses each week. I'm Anita Buffoni, 12 News.
The Department of Health says Rhode Island is now giving about 5,700 shots a day and claims the state's vaccination rate has gone up 110% in just the last week. Today, the state's vaccine subcommittee reviewed the numbers, including the results of the initial targeted rollout. 12 News reporter Anita Buffoni continues our in-depth coverage with that. Anita?
Hi, Shannon. Thank you. Well, after receiving widespread criticism of the slow pace of the vaccine rollout in Rhode Island, the vaccine subcommittee spent a lot of time defending their previous strategy, saying it's put Rhode Island ahead of many states in terms of reducing hospitalizations.
The highly targeted vaccine approach is now picking up speed. The health department continues to report huge declines of COVID-19 infections and hospitalizations. Data outlined during the recent meeting with the state's vaccine subcommittee shows cases dropped among targeted groups, including healthcare workers, those in long-term care facilities, Central Falls residents, and adults 75 and older. And hospitalizations dropped at a faster rate. The health department again defended their initial strategy, despite the failing grades Harvard University gave Rhode Island earlier this month for its initial vaccine rollout.
We all recognize keeping people out of the hospital and keeping them alive are the #1 priority, regardless of any grade or any, assessment anywhere.
On a conference call with reporters Monday, Governor Gina Raimondo pointed to the improving data as evidence the targeted strategy has been effective.
Hospitalizations are the lowest they've been in many months, and new cases are down in every single age group. So the overall picture as it relates to COVID is that we are in a good and stable place.
Now, while the state's overall focus has shifted to moving as quickly as possible, health officials claim they will not give up entirely on the targeted approach and will offer smaller specialty clinics in some hard-to-reach communities. I'm Anita Buffoni, 12 News.